The relationship that a physician has with their patient is the most sacred relationship of all. And it's a relationship that I don't have. I'm not a physician. But what I can do is create a framework for our company that wicks away as much of the other noise so that you and your patient can spend that time together. Going back to trust. To trust someone is to know someone. And it's not with your back turned typing into a computer, but it's getting to know them. And I think that's one of the most beautiful parts of rural healthcare, because it's people taking care of their neighbors and friends.
Today's PSA spotlights David Dill, a visionary healthcare leader committed to improving access to quality care in rural and underserved regions. As CEO of LifePoint Health, David Dill plays a key role in addressing healthcare gaps, especially in areas with provider shortages. Having grown up in rural Kentucky, he's deeply committed to expanding services in underserved communities, ensuring that every patient, no matter their location, has access to the care they need. My name is Dr. James Hildreth, and you're listening to Public Service Announcement. In this episode, we explore the impact of limited healthcare services on rural communities and highlight the essential role LifePoint Health plays in expanding access. David shares insights into LifePoint's efforts to bridge healthcare gaps, and we discuss the challenges posed by racial and geographic barriers to care. He offers practical strategies for improving healthcare access, focusing on innovative solutions to meet the needs of underserved populations. To learn more about this show, or to learn more about Meharry Medical College, visit www.mmc.edu. Welcome, David. And can you just tell us a little bit about your story, introduce yourself, tell us about your background, what motivates you to do the great work that you're doing?
Well, thank you, James, for having me here. This is an honor for me to be here and have the opportunity to tell a little bit of my own personal story, but more importantly than that, the story of what our company does each and every day. I've lived here in Nashville for over 30 years. I grew up in a small community in western Kentucky, and small communities are near and dear to my heart. It's actually what brought me to the company. There are two things that brought me to LifePoint back in 2007. One was the mission and the spirit and the communities that we served. And then two was then our chairman and CEO of our company, Bill Carpenter, who lives here and has just been a great friend for many, many years. And a combination of those two made kind of a match in heaven for me. And I decided to join the company in 2007. Growing up in a small community where it's friends taking care of friends, neighbors taking care of neighbors, it just really impressed upon me, and it has stayed with me all these years, just how special that is and how important it is. And so over the last 17 years at LifePoint, I've been able to serve in a lot of different roles, and currently the chairman and the CEO over the last 6 years.
Well, I have the same story, growing up in a small town in South Central Arkansas. My father's death when I was 11, who did not have access to health care, was the reason I wanted to become a doctor in the first place. So I think we're connected in that. So can you explain to our listeners why there is such a challenge in delivering health care to rural areas and communities in some parts of our country?
We have been fortunate enough as an organization to grow and develop, and we've done that a lot of different ways, through partnerships with communities, through partnerships with large not-for-profit systems and academic medical centers. And I really think our company does the hard stuff in these communities. We don't just go knock on doors saying we want to buy your hospital. That's not how we operate. But we do pick up the phone when people call and say we've exhausted all of our options and we need help, because we all know that healthcare is so important to these communities. It's an economic engine in these communities.
Right.
It's not just a healthcare institution. In many ways, it's an economic engine. So the inability to recruit and to retain physicians in these communities, the lack of access points, just going back to the quick story you told about your father that didn't have access to care, it just pains me every day when I see access points that need to be built that aren't there. And then also the role that we play in educating the community on the important role of taking care of yourself and just getting the education out, but the hard work of recruiting and retaining and investing in technology. We believe at LifePoint, and I personally believe, that people want to stay close to home for care when they can.
Oh, absolutely.
And the role that we play is to make that possible.
And can you help our listeners understand why there are so many? We've all read the stories or heard the stories of rural hospitals that are closing left and right around the whole country, even here in Tennessee.
Yeah.
So what's driving that?
The cost of operating hospitals is real. These community hospitals play a very important role in the delivery system. They have for a long period of time, and I believe they will continue to play an important role. But one of the pressure points that we've dealt with is having to recruit and employ a lot of the physicians to get them to come to our markets. We have a national shortage of physicians.
Yes, we do.
And for a young physician that's coming out of school that has an option to coming to this incredible city, I look out this window and I see what's being built here in Nashville. If I was a young student coming out of school, I would probably want to come to a city like this.
Right.
But there are many physicians, just like yourself, that have a strong passion and commitment to community-based care. And we search for those doctors, we find those physicians, we bring them to the community, but it's expensive. And our whole service line in many cases is dependent on a small group of doctors, and it may be, in some cases, a single doctor. And when that doctor leaves, our service line is non-existent for a period of time. And that's the most difficult part. And I think over time, many community hospitals, if you don't have the support and the apparatus of a big organization around you, it's becoming difficult, not to mention just the regulatory and the compliance environment that we live in as well.
Oh, absolutely. And I think that's why organizations like yours are so important to make this all work. But you've touched behavioral health, acute care, rehabilitation, medicine. How do you put it all together in that context of a rural or community hospital?
Yeah, so in 1999, when our company started, we started as a spin out of HCA. They took a small group of their hospitals that were in smaller communities, and I believe their thought was, as HCA grew and developed, the smaller communities may get left behind.
I see.
But what would happen if we move those hospitals into an organization whose sole focus was to help grow and expand and create access points in those communities? And I think now, 25 years later, we've made the proof point that you can do it. So now today, the company has gone from 20 hospitals to 60 hospitals. We also have, as you pointed out, about 40 rehabilitation hospitals and over 25 behavioral hospitals. So I think we do hard things, and we also do it in partnerships. I think that's something that's very, very important for us. About 15 years ago now, we started a partnership with Duke University. And that was our first real partnership that we entered into. And I believe that there's no way you can do this on your own. You have to be partners, and that's been really become a core competency of our company. So how do we stitch these together? We bring partners to the table. We listen to the community's needs. We aggregate the right resources and make the right investments, all in an effort to fulfill our mission of making communities healthier and keeping patients close to home for care.
One of the things that I think you all do very well is being focused on trust and connecting to the community. Could you just expand on that a little bit? Because I think people in the podcast have heard me talk about it often, how important trust is in the delivery of healthcare.
Yeah. So you don't have anything without trust. And to trust someone is to know someone. And I think about even the interaction like this, having a dialogue is trust building.
Right.
And so over time, I tell all of our communities that come and become part of our company that if you will just take out a single decision that we make, you might get to the wrong picture of who we are as a company. But if you give me time to build a movie and give me time to build trust with you and let you understand what our company is all about, I think we'll show you that we can fulfill our commitment, our promises that we made to you. So spending time together, the CEOs of all of our hospitals, one of the important roles that they play. They are the key decision maker in all of our communities. My job is really just to support them. The most important people in our company are the CEOs of our hospitals because they have the relationship with the people in the community that matter. They get to spend that time with them that I don't get to spend.
Right.
And when you spend that time and you get to know each other, trust is built. Are we perfect? No. Can we get better? Yes, we can always get better.
Yes,
but that
always.
trusted partnership is a cornerstone of our success as a company.
So it occurs to me that what you've done would be a great model to be emulated around some other parts of the country. So if you're going to talk to policymakers or the decision makers who dole out the federal funds, what advice would you give them in terms of what you've learned or what you've done here to make sure this happens in other places?
Well, I think a lot of it goes back to trust, and there's days where I think that's easier than other days. But we're an important part of the healthcare ecosystem, and I spend a lot of my time, as you can imagine, in D.C.
Yes.
and in state houses, here with the governor in Tennessee or up with our elected officials in D.C. They understand the important role that our hospitals play. But it's important for me that I continue to not only share with them the challenges and the successes that we have as an organization, but I tell them stories of what's happening. And I think through storytelling, just like we're doing here,
Yes.
I think we can learn a lot about each other, and that's where trust does get built. I also bring to the table the utilization of technology on how can we create a regulatory framework that brings new payment revenue streams into organizations to deploy technology that's meaningful, whether it's telemedicine, whether it's remote patient monitoring. Those are two that come to mind, but those are discussions that we have as well to help bolster the health system and make it stronger than it is on its own.
Well, I want to take you back to a point you made earlier, which is really felt deeply in lots of parts of the country where there's an acute shortage of physicians, especially primary care physicians. But more particularly, we need them where we need them, which is in rural communities and underserved areas. So is there a perspective you can share with us about some things we could do to maybe focus more attention in those places where the doctors are most needed?
Well, I think reimbursement plays into that. The cost of me to bring a physician into our communities, it's not easy, and the lack of resources within our communities makes it hard for the families that are coming to our communities in many cases. When I think about medical graduates that come from other parts of the world, there may not be access to the resources that they need in their communities. There may not be places of worship for them in smaller communities. And there's some of those things that are hard for me to solve for.
Right.
But the things that I can solve for, I have to. And so, I advocate strongly on behalf of our physicians. We add physicians, across all of our access points, whether it's in our urgent care centers, whether it's in a few of our cases, freestanding EDs. So we're all about building access points to be that catcher's mitt. I view our hospitals, we're that catcher's mitt of everything that happens in the community somehow starts with an access point that we have created. And we need physicians, obviously, to do that. And so we work hard to find those doctors that want to come to our communities, and then we work even harder to make sure it's a great place for them to practice.
Wonderful. Well, one of the things that we know from data is that residents who train in hospitals tend to stay in those areas to practice medicine. Is that one of the approaches you're taking to building your workforce?
Yes, we do have residency programs, not in all of our hospitals, but in a handful of our hospitals, certainly our largest hospitals.
Right.
And the statistics that we see back up exactly the literature and the data that you're talking about. When we can bring a doctor through a residency program, they're more likely to stay in their community. We also have relationships with other large teaching institutions to identify, candidates that want to move into parts of the country that we operate in. I think about our relationship with Duke and all the students that come through Duke and all the graduates that come through Duke. We have a network of 12 hospitals in the state of North Carolina. And many of those communities are fantastic communities for a graduate that wants to stay in North Carolina, practice in North Carolina, and practice in a small community. They don't have to go very far from school to do that, and they can go back and watch a Duke basketball game if they want to.
That's a perk right there.
Now they have to pay for the ticket, but
yes.
they can go back home and enjoy.
One of the challenges I think you're addressing is finding opportunities for residency in rural hospitals and community hospitals, and so I think that's great. So, David, you mentioned the great partnership you have with Duke. Can you just explain why the partnerships and collaborations are so important?
We made a decision almost 15 years ago that we could not do all this by ourselves. And you need partners. It's like a marriage. It's like a family. It's like business. You need partners, and you bring the best out of each other. And so we, 15 years ago, started working on a relationship with Duke, and now we've been able to partner with communities all through the state of North Carolina and even outside the state of North Carolina. And then in our rehabilitation division that has over 40 rehab hospitals, almost every one of those locations has a partner that's the largest not-for-profit system in the community that they serve. So those built-in partnerships, I think it's been an important element of our company because it's a constant reminder that maybe it's a little more difficult. Maybe it'd be easier if you didn't have a partner and you could just make decisions. But having that partnership makes you better. It forces you to the table to have a dialogue to get to a better answer. And so I think partnerships are one of the things that have really differentiated the company, and it's been a very important cultural element to what we stand for.
I totally agree. And when I started my service as Mary's president, I made it clear that we'd have to use partnerships and collaborations to have the impact we really wanted. And I think collaboration makes us stronger. So that's wonderful. The other thing that I wanted to really ask you about is your story is kind of inspirational to some of us who have been thinking about this for a long time. So, and I know we talked about it before we came on officially here, but I'd just like for you to share with the listeners a little bit about what you shared with me about how you got started.
Yeah. So growing up, James, in a small community in Western Kentucky, my father was a basketball coach. I think my team in the office gets tired of me talking about old basketball stories and things that I learned from my dad. But even though you lost your dad at a young age, there's still lessons that you learned from your dad.
Absolutely.
And you're still learning those lessons
Absolutely.
from him all these years later. And my father's now passed away, but there's not a day that goes by that I don't have a lesson that I learned from him somewhere along the way. So I grew up in a family whose father was a basketball coach. My mom was a kindergarten teacher. Grew up in a small town, and I love small towns. And I have in my office a painting that I had done of a very specific picture that I had taken. I sent a photographer out. They found this place that I told them to go find. I told them I wanted it on a June day. My birthday's in June. I wanted it on a June day. I wanted the leaves on the trees, and I wanted it as a constant reminder. So in my office, when you come visit me in my office, you will see that painting. And every day that I walk in there, it's an inspiration around why do I do and why do we do what we do every day. That relationship that you know better than anybody, the relationship that a physician has with their patient is the most sacred relationship of all.
Yeah, absolutely.
And it's a relationship that I don't have. I'm not a physician. But what I can do is create a framework for our company that wicks away as much of the other noise so that you and your patient can spend that time together. Going back to trust.
Absolutely.
To trust someone is to know someone.
Yes.
And it's not with your back turned typing into a computer, but it's getting to know them. And I think that's one of the most beautiful parts of rural healthcare because it's people taking care of their neighbors and friends.
I think that's absolutely right. And one of the things that we're trying to do is to identify young people from rural communities who are bright enough, motivated enough, who want to become physicians to go back to serve their communities. And I think that's something that we're focused on that I think would be very useful to do across the country. I think small town values are something that people talk about, but many of them are talking about it without actually knowing what it really means. And I love the fact that at Meharry, we try to instill that in our students or remind them of the fact that when you're sitting across from a patient, they're entrusting you with their most prized possession, their health.
You know, one other thing that I'd like to add on that is our company's a big company now. I mean, we have operations in 30 states. We have 50,000 employees. We have 130 different hospital sites between acute and rehab and behavioral. We have a lot of partners. But as the company has become bigger, it's important to me that we keep this company as small as we can for as long as we can. And that takes you right back to that community setting of that relationship.
Right.
So no matter how big the company gets, we can't lose that. And if we do begin to lose that, then we've got to stop everything and get back to what made us successful. But that's something I think about every time I look at that painting, going back to that painting on the wall. I think about that every day on how do we make this big company that could feel overwhelming sometimes. We need to keep it as small as we can so you, Dr. Hildreth, can have that conversation with your patient in that most sacred a moment.
I love that. That's wonderful. So I usually ask our guests if there's a call to action they want to share. Is there something that you really want our listeners to know that might inform them or inspire them to do things differently in terms of their health?
Obviously, taking care of yourself and holding yourself accountable to it. I mean, there's incredible technologies that are out there now. There's incredible information that's out there now. I'm so inspired by stories of my friends that have, as I'm now moving into my mid-50s, that like they've looked at themselves differently and they've had their own call to action. But a lot of it is, continue to make a difference. Stay engaged, not just with your health, but stay engaged with your friends, stay engaged with your family. Be a lifelong learner. And as you do that, I think just naturally, whether it's your physical health or your mental health, I think there's a lot of ways that we can do a better job of taking care of ourselves. And part of it is remaining active.
Wonderful. I think that's advice all of us could use. But I do want to thank you for being on the show. And thank you for your leadership of a great company that provides healthcare to people who really need it. So, David, thank you so much. Thanks for listening to Public Service Announcement. To follow along on the rest of our journey, visit www.mmc.edu. And please remember to follow, rate, and review this show wherever you get your podcasts.